Okay, transmission. How does this virus affect infants and newborns? Excellent question. Didn't talk about it. There have been reports of infants and newborns who have contracted COVID. We don't think that it's vertically transmitted, meaning we don't think that it goes directly from the mom to the fetus. The suspicion is that it goes after through contact. The thing that I think makes a lot of parents, doctor parents in this world, very happy right now is there's almost no COVID disease in the population from age 0 to age 14. So I'll just state that again. Kids are not getting sick. Now, there are some exceptions. You know, there's a recent New England Journal article where they went into a hospital in Wuhan, China, a pediatric hospital, and in the entire hospital of 300 kids, they found 2% of them or 4% of them had COVID, which really looked like cough or asthma. So kids are not dying. Kids are not getting critically ill. Kids are not getting sick. There's a whole debate about whether kids are transmitting this disease. It's probably true. But I think if the gist of the question is how does this affect infants and newborns, it's really not. From Bay, I keep reading conflicting information on whether COVID-19 is airborne versus droplet transmission. Do they absolutely know for sure? And so I think if I know Bay well, this is a question about protecting nurses. And so I can tell you what we're doing in our hospital and what our experience has been. And so what we know is that the vast majority of COVID-19 transmission is droplet. And what that means to all the people on the phone call who don't know what droplet means is it's hands to face. So it's getting a droplet, so something that comes from your mouth, either goes onto your hand or falls onto a surface and then is very quickly taken up, touched, and put on the hand, and put on the face. So what does that mean, Bay, in our hospital? And so the only time that we wear an N95 mask, which is to protect against airborne transmission, which is getting it just from particles in the air, is when we're doing something to a patient to make them spit a lot. So when we like suction them or we do something to disrupt them, that's the only time. The vast majority, 99% of the time, or 90, that's not true, 80% of the time that the nurses are in the room with a COVID patient, they're just wearing a simple surgical mask. Only when they're doing things that are going to make them have to get secretions out or spit, which is called an aerosolizing procedure, are we using N95 masks. So the direct answer to your question is there's probably a small amount of airborne spread for nurses, and I know we have a lot in our family. In Hong Kong and Singapore, doing those precautions, which is only wearing a surgical mask when seeing a patient and only wearing an N95 when doing an aerosolizing procedure, there was zero transmission to healthcare providers. We do have healthcare providers who are getting sick, and they're getting very sick. The people who are getting sick are one very clear population, which is healthcare providers on the front line who are having extensive contact with patients and not protecting themselves. So it's, for the most part, general practitioners who are in the office. In New York, it was 3 weeks ago, who didn't know that someone had the disease and spent 25 minutes in the room and then did a nasal, checked their nose. And those are the people there that are getting sick. It's emergency room doctors who 3 weeks ago in New York City did not know the level of protection that they needed when they were interacting with people with active COVID-19 disease. What our experience is in our hospital, and we've been doing this now for 3 weeks, is if you wear the proper protection, you can interact with these patients indefinitely and zero people get sick. So good question, Bay. Jen Toadvine. We are wondering, being in a city, is it really safe to go on a run or a walk, taking in the social distancing measures? Amazing question. Yes, please. If you're in a city, you can go outside. Just follow the rules. When you go outside, peel all your hands when you're going to touch the elevator button. When you touch the door, Purell your hands. Don't touch your face. When you're out walking in the city, don't come within 3 to 6 feet of people. But say hello, smile. No one is giving each other this disease by walking through a city. If there's a bike path, you can walk on it. The only caveat is just don't get sloppy. Don't, the problem with telling people they can do things is that everyone just assumes their old lifestyle. That is not what I'm saying. I'm saying it's safe in New York City, in Philadelphia, to go on a walk. Just follow the rules. Just follow the rules. I would encourage you to wear a mask, not because you're getting the COVID from people when you're outside. It's because as a society over the next couple of months, we need to train ourselves to not touch our face, and we need to tell people that we're taking this disease seriously. It's not because you need to wear a mask in the city, because that's how you're getting the disease. It's all back to the basic 2 to 3 rules. So yes, go outside, have a short walk, breathe, know that the world is going to be here, and then go back inside and follow all the rules.
Dave,
Yes.
on the masks, do they have to be even the simple medical mask, or like a bandana, for example?
I think a bandana is, at this point where the doctors and nurses don't have enough face masks, a bandana is a great idea.
Because it keeps your hands off your face. Yeah.
Exactly. These are not preventing you from getting the disease. This is only preventing you from touching your face. Okay, John Regan.
Sorry, Dave, to interrupt. If you don't have Purell, any suggestions? Because a lot of places are out.
I'll get back to you on that, what people are using in the absence of Purell. I think that's another thing to say to Stella, is this disease is a wimp. Coronavirus is a wimp. It dies as soon as you disinfect it. So I can get back on the exact thing, but just generally any type of disinfectant. And then if you're going out and you don't have Purell, press the elevator with your elbow. Open the door with your shoulder. That's not gonna get you COVID. Ideally, if you have Purell, all you need is a small drop. You're gonna kill this thing. This thing doesn't violate the rules. There's not a mystery disease. And so I think that that's a good point. But as to specifically if people are using things besides Purell, I'll get back to you. All right, John Regan, is a long car ride safe, say 10 hours? If no one in that car has COVID, you can drive for 200 days. And so I think as long as the person, if you're driving by yourself, it's completely fine. If you're driving with Michelle, as long as Michelle has been fine and is fine, drive forever. Kara, I would like to ask Dave if it is necessary to wipe things like groceries down with disinfectant when bringing them into the house. I think the general answer to that is no. I think that, if you live in New York City, where there's a lot of contact with stuff that you're getting delivered, I think it's a reasonable idea to have the delivery person leave the food that they're delivering to you outside your door. You could probably pick it up with a glove and then just open the bag, and all the inside contents are fine. That's an overabundance of caution, but I think is reasonable. What you don't want to do is high five the delivery man. You don't want to shake the delivery man's hand. You don't want to pick up the plastic bag that you're getting from Seamless and have a huge long interaction with that bag, because of course it's possible a delivery person has COVID. But again, if you follow the rules and everything you touch, you just clean your hands, you will not get it. Continue to order food. But no, I don't think you have to have routine groceries wiped down. Christina, I would like to know if it is irresponsible to go to Starbucks drive-thru. I think that's a complicated question. I think if the simple question is, can both the Starbucks barista and you safely interact through that transaction? I think the answer is yes. Is it important that Starbucks and people at work there continue to have jobs? Yes. My general sense, given that we're all hunkered down, is to make your coffee at home. If you're going to go to Starbucks drive-thru, follow the rules. Wash your hands, accept the coffee, wash your hands, and then drink your coffee. And what I mean is a drop of Purell or something equivalent to that. So if you can make your coffee and stay home, I would recommend staying home. You're completely safe to go to Starbucks. Just follow the rules.
Dave, there was one more grocery-related question, which is, what about your clothes when you come home? I guess it's beyond groceries, but like you go out and you come home, should you be putting your clothes in the laundromat?
Absolutely not. Absolutely not. That is a recommendation for healthcare providers, like for me, who I live in rooms with COVID patients, for 12 straight hours. For me, I will take off my clothes and wash them, and I have a whole procedure for that. For people who are generally going out, who are following the rules, wear your clothes. No problem. Stella, if you live in an apartment building and run out of disinfectant wipes, is there a good alternative? I will get back to you on the alternative. I'm sure the answer is yes. Okay. John Regan, if you become sick, how long should you wait before you go to the doctor or hospital? So I think we loosely addressed it, but I'll directly address it, which is don't go to the doctor, don't go to the hospital. The only rule for going to the hospital is if you're short of breath. What is amazing now is during the COVID outbreak is the use of telehealth. And so by far, if you feel sick and you're a little nervous, whatever your healthcare provider is, for us, it's, I work for Weill Cornell. We have Weill Cornell Connect. We have an army of doctors who are at home waiting to take your call, who will tell you that you have nothing or that you have COVID-19 and you should stay home. So do not go to the doctor. Do not go to the hospital. I would encourage you to use telemedicine, which is completely rampant right now because we have a ton of doctors who are at home and will take your call over the internet. Is there clarity about the incubation period if no signs? No, John, I think the incubation period is probably dependent on exposure. And so people who are exposed to a lot of disease, like an emergency room doctor who interacted with a patient for a long period of time without any protection, could be anything from a couple days, to someone who who has an interaction with someone with very mild symptoms, and it can be upwards to 14 days, which is where the CDC recommendation is for people to stay home for 14 days. And then there's been the rarest of reports of it being beyond that. So I would say if you had a casual contact with someone and you don't feel sick at 14 days, then you probably are not going to develop COVID disease. Chris Solis, is there an emerging understanding or hypothesis surrounding contributing to why certain younger patients in their 30s and 50s have been having acute respiratory course compared to their peers? Are these patients truly healthy, or do they have comorbidities? So amazing, Chris, because I didn't have a chance to address this. And so again, everyone listen, please listen to what I'm going to say. This disease affects everyone who's not in the age group of 0 to 14. So 23-year-olds, 35-year-olds, 45-year-olds with zero medical problems are getting this disease. People like that are coming to the hospital. People like that are going on ventilators. There is a very evil narrative early in this disease that said that this is only a disease of old people and people who have hypertension or people who have diabetes. That is not true. I can tell you, because all I do is take care of patients. It hits the entire spectrum of ages. So that includes older people who do worse. We see a little bit more older people, but we see a ton of 35-year-olds. And we will understand it someday, but we don't understand it right now. And so it's not to scare you. Just follow the rules. If you can get this disease from age 20 years old, maybe 16 years old, all the way up to age 105, and you can get sick and end up on mechanical ventilation, on a ventilator. The younger you are, the less likely that is to happen. The older you are, the more likely that is to happen. But we see young people who get really sick, and we see old people who do just fine. And so I think it's a great question, Chris. I don't think we know exactly why young people are also getting sick, but it's just to say, follow the rules. If everyone does it, you're going to be fine. You're not going to get the disease. If you get the disease, follow the rules. You can protect your family. Most people will be fine. If you're short of breath, go to the hospital. So I'm just trying to make it as simple as possible. Mariana, what are the symptoms? What to do if you have them? Okay to use ibuprofen with fever. And so I think I touched on what the symptoms are. The vast majority of people are going to feel body aches. They're going to have a sore throat, and they're going to develop fever. Upwards of 90% of people are going to have fever. So I think that's what it looks like. very interesting question about ibuprofen. We're not using it in the hospital anymore. There's really good data from Germany that there's worse outcomes in people, more inflammation in people who use ibuprofen. So that's simple answer, which is if you have a fever, take acetaminophen, Tylenol. So don't use ibuprofen, use Tylenol. It's very simple. Connor, I'd like to hear a bit about what it's like treating these patients, a couple stories from the front lines on this thing. It's actually fascinating because they all look exactly the same. And so everybody has a cough, everybody has a fever. Most people come into the hospital, they sit on the floor and they just have fevers. A lot will be nervous, which is completely understandable. They look like anybody else. What we see for people who get sick is they get short of breath, and then over 1 to 2 to 3 days, they get more short of breath, and then they get so short of breath that they can't walk to the bathroom, and then we put them on a ventilator. And then our experience has been that these people usually settle out over the next 1 day, and then between 7 to 10 days later, barring a complication, we're able to get these people off the ventilator. At Cornell, we're 14 days into this. Our first patient was a 39-year-old who is now home. So he was a 39-year-old who needed mechanical ventilation. He is off mechanical ventilation, and he is safely at home. And so, this is dealing with these patients is, for a doctor, incredibly simple. They all look the same. They all get the same treatment. For them, it's scary, and it's our job to kind of make them a little less scared. And what I tell every young person or old person that I have to put on a ventilator is, we're putting you on because we are going to get you off. And I think that that's true. So if you have people, or you know people who are sick and they're short of breath, they shouldn't be scared. They should go to the hospital, and we will take care of them.
Yeah. A few more questions that came in that aren't on your sheet. Are hospitals accepting homemade masks, or is that something, like, in my mind, I'm even thinking, is that something like that we should be sharing amongst each other now, homemade masks?
Yeah, I think what I would say is, if you, what the main role for a homemade mask at this point should be for you to use, so that you can free up, if you have medical mask, so that you can give to hospitals or friends who are medical providers. So if you're sitting on a stash of N95 masks, you don't need those masks. You do not need those masks. So if you have a homemade mask or handkerchief and you can wear that, that would allow you to give those masks to your friend who's a doctor, your friend who's a nurse, your friend who's a respiratory technician, so that their hospital is adequately equipped.
Sorry, the new normal. There's a question about the new normal. How long, till there's a vaccine? Will there be spikes as people resume life? A related question. Do you anticipate second and third waves?
Yes. So I think this is incredibly predictable, and so I think social distancing will be for months to potentially a year. Which I know sounds like a lot, but I think the experience from Wuhan, the experience from Singapore, the experience from South Korea, is that the first thing you do is you flatten the curve. The first thing you do is you bring down the amount of cases so hospitals don't get overwhelmed. And then by human nature, people will become a little relaxed with their social distancing. And so there's then a second small spike. And then after the second small spike, it usually comes under control in the population. And so I think social distancing is something that you need to just put in your brain. I think it's something that is just the way of life for the indefinite future. But now that you know the rules, it's not something to be afraid of. It's just a different way of interacting. And as this becomes controlled over the next 3 to 6 to 9 months in this country, then you'll know exactly who you'll be able to hug. You'll know exactly who you'll be able to touch. You'll be able to, I think, feel better. I'd say the first focus for everyone on this call over the next 7 to 14 days is to learn the rules. Learn the rules, because as soon as you learn the rules, it's empowering, and then you can start living your life in a new normal, which will go on for 3 to 6 to 9 months.
Sorry, one other question from Ed. If you are unaware you have the virus during the incubation period, can you infect other people?
Yes, I think the answer is yes. And so this comes from the cruise ship data. And so I think there was a big concern about asymptomatic spread, meaning people who never have symptoms of the disease, spreading it to people who then have symptoms of the disease. What we know from the cruise ship data is that asymptomatic spread, it turns out that most of the people who received the virus from someone else, the person who they received the virus from becomes symptomatic in 1 to 2 days. So it's likely that people who get this disease are shedding the disease 1 to 2 days before they have fever. So what does that mean practically? It means that if you develop COVID-19 and have a fever, know who the people are in your life who you interacted with over the prior 2 to 3 days and let them know. Because then they can follow the rules. They can isolate themselves in their house. They can create a separate bathroom. And then after 2 to 3 to 4 days, if they're not feeling symptoms, they're probably not going to have COVID disease. So simple answer to your question, Ed, is yes, people transmit this disease. But I do not believe that there's this whole group of people out there who are giving this disease to everyone who would never develop symptoms.
Dave, are people becoming immune after they recover?
Yes, people are absolutely becoming immune. The stories you're hearing about people having rebound symptoms is usually the fact that they just haven't fully resolved the disease. So let me say that more clearly. So we know that from a day or two before you have the disease until about 14 days into the disease, that you're spreading the disease to the environment. We know that because scientists have done tests of the nose every single day to know which people are going to spread the disease. They don't do it to everyone, but the scientists know who those people are. What they have observed is that at 14 days, people will not be shedding the disease from their nose, but then at day 16, they will be. We don't think that that's because they've relapsed in their disease or not developed immunity. We think it's just because they're slowly coming down and the test is just picking up a little bit. And so the vast majority, so 81,000 people in China got this disease, 76,000 have recovered with antibodies that prevent them from getting the disease. Wow. The natural course of this disease is that once the world sees it, coronavirus now as a pandemic is going to enter the circulation the same way rhinovirus is in our circulation, the same way that respiratory syncytial virus is in our circulation. But as it mutates, it's going to get milder and milder. And so 5 years from now, you're going to get coronavirus, this exact COVID-19, and it's going to feel like a cold. Just not the first time through the population.
2 pregnancy-related questions. One from a nurse who's treating patients regularly, and she's asking, right now I'm screening people prior to my appointment with them. Is that enough in combo with hand hygiene? She works in wound and ostomy care. Ostomy?
Yep, yeah, absolutely. I think that is the system that is important, is screening people and hand hygiene. I think if you were doing ostomy care at the epicenter in New York City in a hospital where I've seen a lot of cases in the community, you could argue a simple surgical mask would be helpful. But if you're in a community that hasn't seen a lot of the disease, screening and hand hygiene is everything. You don't have to wear a routine mask, and I think those recommendations from hospital systems are completely appropriate.
And our Christy, who's currently pregnant, is wondering if you've treated any pregnant women, and is it more severe at all in pregnant patients?
I've seen 0 pregnant women in our ICU. I think the data is that they're behaving like any generic person of that age. In other words, we're not seeing it more severe in pregnant women. In our hospital experience, we're seeing a male predominance to this disease. It affects men and women, but we're seeing more men. But we haven't seen anything unique to the pregnant population. They get COVID disease. That's 100% true. But it's like a lot of people, which is they get it, they feel terrible, and then they get better. I wouldn't treat a pregnant woman like I would a 95-year-old patient or a family member. I wouldn't put them in seclusion. They still have to exist in society. You still have to take walks. Just follow the rules.
In terms of going to the hospital, you don't just have shortness of breath. If you don't just have shortness of breath, but or when you can't walk and breathe and have a fever, should you go to the hospital if you just have shortness of breath, or when you can't walk and breathe and have a fever? Like, do you need all of those things, or just the short?
Just short. I think I see them all as the same thing, which is it's shortness of breath. So if you're walking and short of breath, you should go to the hospital. If you're sitting and short of breath, you should go to the hospital. If you have a fever, stay home. Chicken noodle soup.
Last question is on the Purell use. Actually, there's one more. Does it mess with the pH balance on your skin, rendering it useless?
No, but you'll get eczema. I'm joking. We are seeing a lot of people who have hand washing related dry skin, which is very common because everyone's washing their hands 100 times a day. But I think simple anti-infections per Purell is completely fine. There's nothing to suggest that Purell is not working, or I shouldn't say Purell, but hand sanitizers are not working. That is completely enough.
What about thoughts around herd immunity, like in the UK? What's your opinion?
I think what the UK is doing is completely incorrect. Herd immunity will happen, but to instantly allow a virus into a population and to get 60% of your population sick will overwhelm your healthcare system. And so I think everybody in the world right now is kind of pursuing a flatten the curve. People will get sick. Let's decrease the amount of people that will get sick. And over time, 18 months, the population will develop some herd immunity. The disease will get more mild. Yeah. But that's not a strategy for right now.